New rules restricting the number of hours doctors can work are coming into force, but it's leading some to ask, is the NHS facing chaos? Currently, doctors work around 56-hour weeks, but the EU Working Time Directive will limit medical staff to work no more than 48 hours a week, and it's not getting the thumbs up from everyone. Some medical groups claim it could force hospitals to close and put patients' lives at risk because of the impact such limits will have on the quality of training the doctors will receive. Matt Jameson-Evans from campaign group Remedy says the impact will be felt across the NHS.
Is that we've already got a very stressed system, and across the country there's a phenomenon called rota gaps, which means that we've got an undersupply of doctors in many rotas. We've heard of rotas which are undersupplied up to 40–50%, and that's actually led to some closures in a couple of units in Wales because they simply don't have enough middle grade doctors to supply a service.
And he says it'll lead some doctors to fudge the figures.
We already know that doctors are falsifying their hours, and by that I mean underreporting the amount of hours that they're working. And obviously when you're trying to cut down doctors' hours even more, there'll be more incentive to do that. The motives of doing that is either that they see the need to be there to provide the service, or that they see that their training is falling below the amount of experience that they should be having. And they want to supplement that with spending more time doing surgery, learning procedures, etc.
The Department of Health has moved to permit junior doctors working in certain specialities to continue on 52 hours a week rotas for a further period, while the spread of the H1N1 swine flu virus has prompted calls for the government to suspend the directive altogether. But the government say the number of patient deaths has fallen in places where the 48-hour week has been implemented, and hospital consultants are reportedly preparing to work more nights and weekends to support trainees whose hours are cut.